suboccipital triangle. It is situated on either side of the occipital region. The suboccipital triangle, it is situated on either side of the middle line of the occipital region. It is bounded superolaterally we have obliquus capitis superior. Superolaterally we have one muscle that is called obliquus capitis superior. This obliquus capitis superior arises from the transverse process of atlas. We know that cervical vertebra are 7 in number. Out of this first vertebra we call it as atlas. So the obliquus capitis superior, which forms the superolateral boundary of the suboccipital triangle, arises from the transverse process of atlas, and it is inserted into an area between the superior and inferior nuchal lines. We know that superior and inferior nuchal lines are present. So superior nuchal line is present here. Superior nuchal line is present here, and below that we have inferior nuchal lines are present. So the obliquus capitis superior arises from the transverse process of atlas, and it is inserted into the lateral part of the area between the superior and inferior nuchal lines. Here it gets inserted here. It gets inserted into the lateral part of the area between the superior nuchal line and inferior nuchal line, that is the superolateral boundary of the occipital triangle. Coming to the superomedial boundary of the occipital triangle, it is formed by rectus capitis posterior major. So the rectus capitis posterior major, it arises from the spine of the axis. So atlas is the first cervical vertebra and axis is the second cervical vertebra. So it arises from the spine of the axis, and it is inserted to the area below the inferior nuchal line. So this is the superior nuchal line, and here is the inferior nuchal line. Here it is inserted into the area below the inferior nuchal line, just a little bit lateral. So that is the insertion of the rectus capitis posterior major, which forms the superomedial boundary of the occipital triangle. And coming to the inferiorly, the occipital triangle, it is bounded by the obliquus capitis inferior. Obliquus capitis inferior, which arises from the spine of the axis, and it is inserted to the transverse process of atlas. So this is the spine of the axis. This is spine of axis, and this is transverse process of atlas. So the suboccipital triangle, it is bounded superomedially by the obliquus capitis superior, and superolaterally by the obliquus capitis superior, and superomedially by the rectus capitis posterior major, and inferiorly by the obliquus capitis inferior. So these are the boundaries of the suboccipital triangle, and here the insertion of the obliquus capitis superior overlaps the insertion of the rectus capitis major. Here coming to the roof, it is formed by the semispinalis capitis. Here we have semispinalis capitis. Roof is formed by the semispinalis capitis, which is cut end of the semispinalis capitis here medially, and also longissimus capitis. Roof is formed by two muscles, semispinalis capitis and longissimus capitis, and this semispinalis capitis, it is inserted to the medial 2/3 of between the area between the superior and inferior nuchal lines. So here the insertion of the obliquus capitis superior, which is inserted into the lateral area between the superior and inferior nuchal lines, and semispinalis capitis is here. This is the semispinalis capitis. As it is inserted to the medial area between the superior and inferior nuchal lines. Okay, and coming to the roof, the inframedial part of the roof, it is occupied by the inframedial part of the roof consists of greater occipital nerve. The inframedial part of the roof consists of a greater occipital nerve, which winds round the lower border of the obliquus capitis inferior. It passes upwards, and it pierces the semispinalis capitis, and also it also pierces the trapezius muscle. This is the trapezius muscle, and become cutaneous, and it supplies the posterior part of the skull up to the vertex. The greater occipital nerve, it winds round the inferior border of the obliquus capitis inferior, and it ascends upwards, and it pierces the semispinalis capitis here and also trapezius, and it becomes cutaneous by supplies the posterior part of the scalp up to the vertex. Vertex means here is a vertex. Okay, and coming to the roof only, the superolateral part of the roof, superolateral part of the roof consists of one important artery. We call it as greater occipital artery is present here, occupies the superolateral part of the roof. Greater occipital artery occupies the superolateral part of the roof. We know that greater occipital artery is a branch of the external carotid artery. It passes backwards, upwards, it passes backward where it passes deep to the posterior belly of digastric, and here it rests here in the suboccipital triangle. It rests on the longissimus capitis, obliquus capitis superior, and also semispinalis capitis, and later it pierces the trapezius muscle, and it also becomes cutaneous, and it supplies the posterior part of the scalp. In the suboccipital triangle, this greater occipital artery, not greater, occipital artery, it gives mastoid branches, and also it gives descending branches, and also it gives muscular branches. The descending branches of the occipital artery divides into two, superficial and deep. Superficial artery, it joins with the anastomosis with the superficial branch of the transverse cervical artery, which is in turn is a branch of superficial temporal artery, and the deep branch joins with the first part, costocervical trunk, and deep branch joins with the costocervical trunk. So, great occipital artery, it occupies the superolateral part of the roof. It rests on the obliquus capitis, and then on the spleen and the semispinalis capitis. It also rests on the longissimus capitis here, and furtherly it pierces the trapezius, and it supplies the posterior part of the scalp. Here in the suboccipital triangle, this occipital artery gives muscular branches, mastoid branch, descending branches. The descending branches, they divide into superficial and deep. Superficial branch anastomose with the branch of the transverse cervical artery, and deep branch anastomosis with the branch of the costocervical trunk. Okay, and coming to the contents of the suboccipital triangle. Contents of the suboccipital triangle, we have vertebral artery, suboccipital nerve, and suboccipital plexus of veins. These are the contents of the plexus of veins. Okay, so contents of the vertebral artery. By contents of the suboccipital triangle, we have vertebral artery, suboccipital nerve, and suboccipital plexus of veins, and these lies on the floor of the suboccipital triangle. The floor of the suboccipital triangle, it is formed by the posterior arch of atlas. Here is the posterior arch of atlas. Here is the posterior arch of atlas, and also posterior atlanto-occipital membrane. Posterior atlanto-occipital membrane extends from the posterior margin of the foramen magnum to the posterior. This is the foramen magnum, right? So the posterior margin of the foramen magnum to the posterior arch of atlas, they form the floor of the suboccipital triangle. So the superolaterally, it is related to the obliquus capitis superior, and superomedially it is related to the rectus capitis posterior major, and inferiorly it is related to the obliquus capitis inferior, and for roof it is formed by the longissimus capitis, semispinalis capitis, and also the inframedial part of the roof consists of greater occipital nerve, which is the thickest cutaneous nerve of the body, which supplies the posterior part of the scalp up to the vertex, and the superolateral part of the roof, it is occupied by the occipital artery, which is a branch of the external carotid artery, and it supplies the posterior part of the skull, but it also supplies the muscles here in the suboccipital triangle, where it is divided into superficial and deep. Superficial branch anastomoses with the superficial branch of the transverse cervical artery, deep branch anastomoses with a branch from the costocervical trunk. Okay, and coming to the floor is formed by the posterior arch of atlas. Here is the posterior arch of atlas. This is the posterior arch of atlas, and posterior atlanto-occipital membrane, which I have represented with green color. Posterior atlanto-occipital membrane, it arises from the posterior part of foramen magnum to the posterior arch of atlas. So that forms the roof. So coming to the contents, we have vertebral artery, suboccipital nerve, and suboccipital plexus of veins. Coming to the vertebral artery. Vertebral artery, it is a branch from the first part of subclavian artery. This vertebral artery first appears, here is the vertebral artery. Look here. So this is the vertebral artery here. This is the vertebral artery. So this is the vertebral artery. So the vertebral artery, the third part of vertebral artery is seen in the suboccipital triangle. So the third part of vertebral artery, we can see it in the third part of the suboccipital triangle. Usually the vertebral artery is a branch from the first part of subclavian artery. First part of subclavian artery, it ascends upward, first appears in the scalerovertebral triangle, and it is ascends upwards into the foramen transverse area of the upper 6 cervical vertebra. Foramen transverse area of the upper 6 cervical vertebra. From foramen transverse area of the C2, that means access to the foramen transverse area of the C1, that is atlas, it makes an lateral bold curve which protects the artery from the movements of the skull at the atlanto-occipital joints. And third part of vertebral artery, after emerging from the foramen transverse area of the atlas, the third part of vertebral artery is seen in the suboccipital triangle, where here the third made an arch below the posterior tendons of the posterior atlanto-occipital membrane. We can see the below the posterior atlanto-occipital membrane, we can see the arch of vertebral artery is here. This vertebral artery, it lies in the lateral mass of the atlas, and between the bone and the artery, suboccipital nerve intervenes. Suboccipital nerve, it is nothing but a C1 nerve. Suboccipital nerve is nothing but C1 nerve, and this artery, this vertebral artery, here it goes downwards and backwards. Here it enters into the vertebral canal by anastomosing with the same artery by forming the deep basilar artery. So the third part of vertebral artery is seen in the suboccipital triangle. And coming to the nerve, so the suboccipital nerve, it is nothing but a branch from the C1. So C1 is dorsal ramus, we call it as suboccipital nerve. So the suboccipital nerve is also seen here in the below the vertebral artery. So this is the suboccipital nerve which have represented with green color. It supplies the muscle here. This suboccipital nerve divides into dorsal and ventral branches. This dorsal branch we can see in the suboccipital triangle. It supplies the muscles here, that is, it supplies the muscle here into the obliquus capitis inferior, obliquus capitis superior, rectus capitis posterior major, rectus capitis posterior minor, and also it gives a tweak to the greater occipital nerve. Here the obliquus capitis inferior muscular branch, it gives a tweak to the greater occipital nerve here. So the suboccipital nerve we can see here in the suboccipital triangle. Suboccipital nerve, nothing but the C1 nerve. C1 nerve divides into dorsal and ventral branches. So the dorsal branch is seen in the suboccipital triangle, and the ventral branch, it joins with the ascending branch of C2, and from the loop of C1 through hypoglossal, it supplies the C1 through hypoglossal supplies the omohyoid, superior belly of omohyoid, geniohyoid, and also thyrohyoid. And also this C1 ventral branch, it supplies rectus capitis lateralis and rectus capitis anterior also. So that's about the suboccipital nerve. And coming to the suboccipital plexus of veins, suboccipital plexus of veins are formed by the veins from the transverse sinus and veins from the occipital plexus, veins from the occipital veins. ఒకసారి శివ ఒకటి ఒక టాపిక్ ఒక చిన్నది చూసేసుకుని మళ్ళీ So coming to the suboccipital plexus of veins, suboccipital plexus of veins are present in and around the suboccipital triangle. They collect the, so suboccipital plexus of veins, they are formed by the veins from the muscles, and also veins from the transverse sinus through emissary veins, and also veins from the internal vertebral venous plexus. They together form the suboccipital plexus of veins, and finally these veins, they drain into the vertebral veins. So that's about the contents. Vertebral artery, third part of vertebral artery is seen below the posterior arch part of the posterior atlanto-occipital membrane, and it lies on the lateral mass of the atlas, and between the bone and the artery we have suboccipital nerve, which is nothing but the first cervical nerve is seen, and the suboccipital nerve, it supplies all the muscles in the suboccipital triangle. It divides into anterior branch and dorsal branch. Nothing but dorsal branch and ventral branch. Dorsal branch is in the suboccipital triangle, where the ventral branch along with the C1 through hypoglossal, it also supplies the geniohyoid, superior belly of omohyoid, thyrohyoid also, along with rectus capitis lateralis and anterior muscles. And coming to the suboccipital plexus of veins, suboccipital plexus of veins are formed by the muscles, veins from these muscles, and also transverse veins from the veins from the transverse sinus through emissary veins and internal vertebral venous plexus. These together forms the suboccipital plexus of veins in and around the suboccipital triangle, and also these suboccipital plexus of veins, they drain into the vertebral veins. So that's about the suboccipital triangle.